really need a doctor is to get these suckers out, because this is a 21-year-old decision, and when I say 21-year-old decision, I mean something that's not very well thought out.
Now that Lucy's brain aneurysms are gone and her surgical risk is minimized, I hope Paul thinks she's a viable candidate for surgery, because she really deserves to be healthy and happy.
Want to feel that nose again one more time? Well, you really are collapsed here. You have no airway at all.
Does that hurt? Not so much.
No, but
huh?
I'm so used to it hurting. I think it's a natural reflex.
So let's just see if there's anything different in there.
Do you think that's a scar right there?
I don't think so. She already had an incision here. This, to me, looks pretty intact.
A lot of what we do depends upon blood supply.
So a scar blocks that off, or?
Previous dissection disrupts blood supply. I want to make sure that blood supply coming from the other areas is preserved enough so that you will heal.
So you can still do it, though, right?
So, yeah, so let's talk about improvement.
You have a good chance of 50% improvement and a good chance it could look worse.
Really?
Yeah. You could lose the entire tip skin. That is on the table.
Are you questioning that I'm having this done at all?
So what happened? Why'd you even do whatever you did?
I've been modeling for 15 years now. And all these young girls, 19 years old, 20 years old, were taking over my job. And I wanted to have some fillers around my eye. I went to Turkey a year ago, and I talked to this doctor. She said, if we put fat instead of fillers, it's gonna last longer.
So at that point, you decided, okay, I'm gonna do it.
I'm gonna do it, it's easy. She told me in 10 days I can go back to work, because I mentioned in 15 days I have a trade show, I need to go back to Vegas. In 20 days, swelling wasn't going down at all.
Did you see other doctors about
I saw about 20 doctors. Most of them said they don't do this revision anymore because you're taking all the responsibilities of the bad doctor work. They prefer to have
Are we crazy?
It's a little late for that. It's a little late to wonder that one. Are we crazy? Yeah, I'm crazy. I'm crazy to take on these incredibly impossible operations on national television and hang out with Paul all day long. For a woman who basically makes her living from her face, this must be devastating.
If it was around my body, I
Right.
could cover up with dress, but this is something that I cannot hide.
What are your goals?
I want my eyes to look equal. I want to have a flat eyes. I just want to look like the way I looked before.
Let's go to the exam room and see what's going on.
Thank you.
Knowing that there have been doctors that rejected her revision, it's just, okay, this is gonna be another one. You know, like, if 20 doctors are gonna reject you, then why not them?
All right, so as a result of all this weight loss, what plastic surgery procedures did you have to correct all that?
The body lift. But after I had the body lift, I had a C-section, and the OB just sewed me back like a wave.
Yeah. Pregnancy will obviously stretch out the skin and undo a lot of the positive effects.
I went and I had the body lift too.
You did?
I went to the surgeon who actually did the gastric bypass surgery.
Yeah, that's the thing.
You had
Our-
plastic surgery done by a
But-
general surgeon.
Everything was popping out because I had to literally shove the skin in.
Plastic surgery for massive weight loss patients is very challenging under normal circumstances when you're a trained, board-certified plastic surgeon. When you're not a plastic surgeon, I can't even imagine it's even doable. So where is the major problem area?
The area below my incision and my pubic area, once the swelling went down, that started to swell. My stomach was really, really flat, but then that was really puffy.
So it's the fupa,
Okay.
right? You never heard the expression fupa? Who doesn't know fupa?
Fupa?
I have a very big fupa.
Fupa. So
Sounds
this
like a faux pas.
right.
But I don't even know what a fupa is.
That is going to follow you. What's up, Fupa? I'm gonna be like, hey, my sister Fupa's here.
It's okay. My kids are Polynesian. I'll just say it's a Polynesian word. Fupa.
Did you have breast surgery?
No, she
No,
needs breast.
I have a lot of mass. Just from the weight loss, they're so long.
And do you have back pain with your breasts?
Oh my God. My back is killing me.
Yeah, that's because of, the weight of your breasts.
Well, can you take them off?
How does this affect your life? I mean, it make intimacy challenging
It
or
makes what?
Really?
It's not even in her vocabulary. And this is my problem. Her intimacy issue is my problem because
Isn't that great?
she meets these guys and they think that she's fabulous.
Yeah.
And then they're going out and they're having a good time. And the minute that they want to take her clothes off,
Yeah.
and she's like, I'm done with the relationship.
Right. I'm not
feeling
So
it anymore.
when is she ever gonna leave the house?
Right.
She will never leave the house because she's not having sex. They want
The day of the surgery, and I'm not joking about this, they both came in with like a really big block of ice. I was there probably an hour lying there with the ice.
That's an automatic burn after 15 minutes.
Dr. Ice was your anesthesiologist.
Dr. Ice was my anesthesiologist. I'm not kidding.
The problem with using ice as an anesthetic agent is that it kills the tissue before you operate on it. So he essentially was operating through dead skin, which just wouldn't heal properly. You know, you have a really significant problem. I don't mean just cosmetically, I mean just physiologically in the tissues. So we really need to have a very close look at your stomach and see if there's enough loose skin to do the job we need to do. So let's go take a look.
Okay,
all right? As far as things that can go wrong with a tummy tuck, Desiree had every one of those things occur. There are things I need to know. You can see that your pubic area has been pulled way up in your pubic skin with the hair-bearing component is very high. See, she does have some laxity, so that's good. You are a little more lax now, but the skin is very, very damaged. What we theoretically can do is make an incision here and lift everything up and lift the pubic skin up as well and bring it down and stitch it down here to put everything back where nature wants it. I think it could be improved, but it's risky. What I'm concerned about is the notion that it's irreversibly damaged the tissue so that it may render it potentially unfixable. And the question is, are you willing to take on that risk?
Yes, I am.
Yeah?
Or I wouldn't be here. Yeah,
Right.
definitely. I just kind of have that feeling there'll be a brilliant outcome, but I'm ready to take the risk.
And fingers crossed that this heals beautifully, okay?
So are you gonna get the fat from the back, right?
Oh, yeah.
These your first 2 body implants?
And my last,
So how did that happen?
well,
How does that work?
so he pulled out the biggest needle I've ever seen. He numbed one side, and from there, he just cut me open.
Did you ever have the thought, I know he's not a surgeon, but he's got drugs, needles, and a scalpel and surgical equipment, and he's operating on me?
That didn't occur until after he already had this instrument in my skin, and I could feel it going up against my rib cage and separating.
That's a blunt dissector.
Yeah, sure.
And of course, if he went a little bit the wrong angle, then he can puncture into your lung space and collapse your lung.
Easily. One of the reasons we go to medical school and learn things like, you know, anatomy and surgical technique is to prevent injuring adjacent structures, the liver and the lung, and other things that essentially, if you get too deep, will kill you. In this particular case, the examination will tell us everything about what we can expect afterwards. All right, so let's go have a look.
Sounds good. I really needed doctors to get these suckers out because this is a 21-year-old decision, and when I say 21-year-old decision, I mean something that's not very well thought out.
We need to look at where they're located. The deeper they are, the more difficult they're going to be to get out, the more pain you're going to have. Let's look, all right, so let's look at this one. Whoa, this is big. Whoa, those things are deep and huge. No wonder Ashley is having so much discomfort. Martina has the largest pair of breast implants in all of Europe.
Those are huge.
So look how flat.
Oh, the poor girl, he has no butt.
She has anterior projection, but no posterior projection. So why don't we bring Martina in and go over this with her?
Can you please send in Martina?
Hello.
Martina? Dr. Nassif?
Yeah. Hello?
Terry Dubrow, nice to meet you.
Yeah.
Hi, Mike, the boyfriend. Hi.
Terry Dubrow, nice to meet you.
Thank you.
Please have a seat.
Yeah. I traveled so far to meet the doctors to ask them, can I have really huge butt implants?
I like how you both have almost the same hair coloring.
Yes.
Yeah, when we met in school, we are a little bit like twins.
You met in school?
Yeah.
Yes, we was senior at high school, and since we are a couple.
You knew
Since
each other
high school?
Yes, since high school.
That long, no kidding. That's
And
very
when we
nice.
we worked for the same airline, and now we are also partner in business and in life.
Wait, but you work for the same airline?
Yes, I was a pilot, and Martina was a flight attendant.
So what is the name you go by in Germany?
Martina Big.
Martina Big.
Yeah.
So big.
Because big is not big enough.
Right. You have 2,000 in there?
No.
What do you have?
3,700.
In each?
Yes.
3,700 in each?
Yes.
Those breasts are ginormous. How could you even walk without toppling over?
How many operations did it take you to
One
get?
surgery and the rest is fill-ups. Here's a valve and there's a valve.
Oh, so you have a tissue expander in
Yeah.
there. So you have a little port and a valve that someone puts a needle in and puts more in?
Yes.
Tissue expanders are very safe to use in the short term, particularly in breast reconstruction. They are absolutely not meant to be used in the long term, and if you do so, they could expose you to the risk of losing both of your breasts.